Diseases to talk about what we're seeing and why we're seeing it. And of course, Karen Gambino from Deaf Access Services is here today to provide the American Sign Language to those who may have a hard of hearing issue. So let's get right into the numbers. The most recent date, which was yesterday, there were 761 new cases for a total of 5,533 new cases in the past week. The average is 580 per 100,000 residents over the past 7 days. That is extremely high. It's nearly 6 times higher than what the federal government, the CDC, declares a region of high transmission, which is of 100 or greater. Positivity rate was 9.5. We'll talk a little bit about the positivity rates in a second, but we have not seen tremendous jumps in the positivity rate recently, and hopefully that's a result of a number of things, including the high vaccine numbers that we have in general in Erie County, as well as the most recently required mask requirement for indoor public settings. Now, this might be a little tough to see if you're watching on television, but this is the regional daily and weekly cases for the Finger Lakes and Western New York regions. This is as of December 5th, not yesterday's data. But unfortunately, the Western New York and Finger Lakes regions have the highest percentage of rates of new daily and weekly COVID cases in all of New York State. And some of these rates are exceptionally high for daily rates as well as for weekly rates. Erie County's been hanging out around 10.4%, 10.8% on a 7-day period. That actually is the lowest rate among all the Western New York counties, which are in the 11, 12, or 13 category. I also include the Finger Lakes number here because there are counties considered in New York's purposes for the Finger Lakes, even though we know they're part of our Western New York region, like Genesee, Wyoming, and Orleans. So you can see the most recent numbers. It's not great in any parts of what would be considered Western New York. And unfortunately, we are the worst when it comes to the rest of New York State. So case data, 5,537 cases last week was the highest weekly case total that we've ever had, and it was an increase of 30% from the previous week. So at any time during the pandemic, we never had a week with this many cases, and it was an increase of 30%. And in recent days, we've had three highest days we've ever seen with cases. On November 30th, it was 899 cases. On December 1st, it was 948 new cases. And on December 3rd, it was 981 new cases, all in a 24-hour period. And this is scary because we know a certain percentage of those individuals are going to get very sick and potentially require hospitalization. And the averages are there's a small percentage of those that will also unfortunately perish from COVID-19. So we want to continue to see that number go down, not go up. COVID case data update also indicates that for last week, the positive COVID-19 test data was 10.8%. It was an increase of almost a full percent from the previous week of 9.9%. And the highest weekly positivity rate we've seen since May of 2020. The 30 to 39-year-old age category had the highest case total. We've seen this repeatedly in the last few weeks, though age groups under 14 years had the highest positivity rate of 13.5%. So unfortunately, children are the ones who have the highest rate of transmission in our county. We know kids can catch it in family settings, they can catch it in sports settings, and they can catch it in school settings. That's why masking of children is so important, because even if a child has a very mild case or is asymptomatic, they could still pass it on to an adult in their family household that is much more at risk for a serious illness or death. And we do know there have been children in our community who have been admitted to Oishei Children's Hospital for COVID-19 and the serious illness that can result from it. So it's just because a child catches it does not guarantee that the child will have no illness whatsoever. The cases per zip code for the week ending December 4th, I don't have any good news to report. There is no part of Erie County that has good case rates. It's bad in the urban, suburban, and rural settings. It's going to be difficult for you to read this. You can find this information on our website. It will be released a little bit later today. But there's just ridiculously high numbers in communities. One part of the city of Buffalo, the 14203 zip code, had the highest rate as it pertains to its population. Basically, more than 1 out of 100 residents in that area had caught a new COVID case. The same is for East Concord in the southern part of Erie County. Eden, very high. Lackawanna, almost 1 out of every 100 residents caught a new COVID case in just 1 week alone. Lancaster, Wales, I mean, you look at it. Urban, just starting from the top. Urban, rural, rural, urban, suburb, rural, / suburb, rural, city, rural, suburb, suburb, rural, rural, suburb, suburb, city, city. So it's everywhere in Erie County when you look at these zip codes. And this is just those communities that had a rate of 600 or greater new cases per 100,000 people in the past 70 days. If you go through the whole list, it is very high. These are numbers we never would have believed 6 months ago, 8 months ago. We would have never believed that our community could have numbers this bad. It's bad. Hospitalizations, the hospitals are hanging on pretty much for dear life, but the numbers are continuing to trend upwards. COVID-19 patients increased 33% during the past 2 weeks. The hospitals are at or near capacity. I know ECMC's at full capacity. I believe South Buffalo Mercy, Sisters Charity Hospitals at full capacity. Bertram Chafee Hospital in Springville is 1 bed away from full capacity. Our total countywide is 90.6% of beds are occupied. When it comes to ICU beds, it's about 86%. On December 5th, there were 529 COVID-19 patients that were hospitalized across Western New York.